Venowave is a compact battery-operated peristaltic pump that generates a wave-like motion in the lower leg. This produces a volumetric displacement of blood and tissue fluids, which translates into an upward increase in venous flow. The Venowave VW5 increases peak venous flow in the popliteal and common femoral veins, as measured by duplex ultrasound. The Venowave is an FDA, CE, and Health Canada approved ISO-compliant Class II medical device. It weighs in at only 250 grams and runs on a single AA nickel metal hydride rechargeable battery. The Venowave enables an active lifestyle for the patient and improves their quality of life. The Venowave heals wounds by increasing circulation of the lower leg, which improves oxygen levels and increases arterial and venous flow. The Venowave can improve conditions for several types of wounds, including venous wounds, arterial wounds, and diabetic wounds.
My name is Perry Meyer, and I'm the medical director here at the Meyer Institute. Set up this institute about 5 years ago, and we're a center of excellence for diabetic foot and wound care. We saw about 16,000 patient visits last year, and about 9,000 of those were wounds, diabetic foot wounds. So it's a fairly busy practice. The Venowave is different. So it's a different approach to this problem. It's very innovative, and because it's novel, and because we've seen some results, positive results, it's worth using it and expanding our use. The advantage is obvious, because for these people who have no other option other than amputation, it saves them. And they are already suffering because of pain, and the Venowave, in our experience, has helped with that. So do I recommend it? Yes, I do, for those reasons, because it offers us in this subset of patients, which you may say, well, there's only a few of those people. No. Today, when you came in here, we had 5 waiting of those kinds of patients here. So it's not unusual in a wound care practice, a diabetic wound practice, to see that kind of patient all the time, and they're stuck. We have to be realistic about what the outcomes are, but these people, we are giving quality of life back to someone who would have no quality of life.
Even though my mother was old, she had great healing capabilities if she had a good blood supply. I feel that if I had known about the Venowave when the first injury had happened, that she would never have had to lose her leg. My mother was in her early 80s, and she had developed an ulcer on her toe. And this continued for quite a while. I went to visit, we took her to see the best doctors, vascular surgeons. They had nursing care coming to visit the house every day, but the wound wasn't getting any better. Fortunately, I met John, and he was asking about how things were with me, and I started telling him about my mother. And he suggested that he had this venous transfer pump, which is a strap-on device called the Venowave, which you put on your calf. And so I got one from John and started using it. What I would do is I would strap it to her calf and sit down and have it play cribbage for a couple of hours. And after doing that for about 30 days, the wound was completely gone, completely healed, nothing at all, no problems with it. I mean, considering the 14 odd months or so that my mother had with her first ulcer, and the amputation cost of probably somewhere, the total cost would have been probably somewhere in the neighborhood of $20,000 to $30,000. And yet a simple Venowave would have been a fraction of that cost. So it makes a lot of sense for people who have serious issues to use the Venowave.
I was trained as a hematologist 35 years ago. I differentiated entirely into the field of thrombosis. I came to master in end of 1969, early 70, to establish a thrombosis program. There have been patients who have had venous ulcers, or actually venous and arterial ulcers, who have claimed that wearing the device helps them. The mechanism by which this would work for venous ulcers is pretty obvious. If you lower venous pressure, you're likely to heal venous ulcers. It's less obvious for arterial ulcers, but it would be based on the same rationale as reducing intermittent claudication. That is, by reducing venous pressure, you increase arterial inflow, and it's the reduced arterial inflow that's responsible for the arterial ulcers.
The Venowave is an effective, drug-free therapeutic solution. It can be used in hospital and at home. It offers greater effect than compression stockings alone, has good patient compliance unlike pneumatic compression devices, and is cost-effective.